One conversation I have regularly, whether it's with employers or employees looking at their benefits, is what's the network? So let's talk about the common ones, HMOs and PPOs, and let's talk about a couple of less common ones, which are open networks and EPOs. Let's take a look. So before we jump into the differences between networks, let's talk about why we have networks. Networks were set up initially as a cost containment. And what insurance carriers were trying to do was negotiate better pricing with physicians and then funnel the patients into those physicians through their employers. Now, one of the other things is that it does make claims convenient. The doctor's office knows exactly where to send the claim. Claims are paid quickly and easily, we hope, and we go from there. Now, the good thing about it is it has created somewhat of a playing field or a marketplace for both patients and doctors. So let's start looking at the differences between the different types of networks. What are the differences? Now, what we're going to do is we're going to go from the left to right, talking about the least expensive to the most expensive. Now, the least expensive is an open network. And basically, it's kind of not like having a network at all. You go to whatever doctor you want to, whenever you want to, and there really is no in or out of network benefits because what they're trying to do is they're trying to make it based on reference-based pricing. And so the insurance company negotiates claims based on a percentage of what most hospitals will accept for Medicare. Now, my opinion on that is this. It's a great idea. In reference-based pricing and open networks, there's a place for them, but you have to be really careful because doctors and hospitals are becoming more and more reluctant to provide services to patients for this because it's always a fight. So let's move on to HMOs. HMOs, when you're looking at groups, your HMO factor is always going to be your lowest rate. The reason for that is that it really has a controlled movement through the medical field. So you have to have a primary care doctor that you go to first for everything. If you want a referral, you have to get a referral from your primary care to go to that referral. And there's only in-network benefits. There are no out-of-network benefits. Now, my opinion on this, HMOs aren't a bad thing to have. I had an HMO for several years. If you're generally pretty healthy, you're going to go to your primary care doctor first anyway. So why not just always go there? And the savings with premium is substantial enough that if it's a little bit of a hassle once or twice, it's worth it. The second one, or the third one I want to look at is EPO. All right, EPOs, the way they work is that you're going to be able to go to the doctors that carrier, and typically UHC is or United Healthcare is the one that does this the most, that you can go to doctors that you are directly contracted with UHC, and it works just like a PPO. You don't have to have a primary care doctor. You don't have to ask for a referral. You have in-network benefits, but you have no out-of-network benefits. My opinion, I like these plans. I sell a lot of these plans. And if you're using a large network like United Healthcare has, the likelihood of you not being able to find a doctor that works for you, that you want to work with in network, is hard. So go ahead and take that 5 to 7% rate decrease from a PPO and go with it. Now, the last one and the most expensive one is a PPO. I do have some PPOs. I would say I have more HMOs and EPOs than PPOs. But PPOs are the easiest to work with. They are typically going to be large. You don't have to have a primary care doctor. You don't have to have a specialist. You can go both in network and out of network. And so you can kind of do whatever you want to do. But doing whatever you want to do does come with a cost. My opinion is I think sometimes the rates are kind of inflated. And especially if you're using a large carrier like a Blue Cross or a United Healthcare or a Aetna, just one of the large carriers, I don't think necessarily that it's a good thing to have. You're just paying for more than what you need. So it's not that it's bad. It's just I think that there's less expensive options that work just as well. I hope you learned something about networks. There's four primary ones, and if you have any questions about those or how they work, give us a call. If you're our client, great. We'll always answer that question. And if you're not our client, guess what? We'll always answer your question. We're here to help. So give us a call or reach out to us. Thanks a lot.